morning, everyone. Please take your seats. Thank you. Thank you very much. Good morning. Hello. My name is Jean Kittson. Can you still hear me? No. My name is Jean Kittson, and it is my great privilege and pleasure to be your MC once again for this magnificent conference, the APNA. Thank you. The APNA 2000 conference for 2019. Hooray! It's going to be so exciting, and my job is to offer you a roadmap for the conference ahead so that you won't be found wandering aimlessly around the very tempting wine bars of Adelaide. And to kick off on our roadmap, it is my great pleasure is our Welcome to Country. And it is my great pleasure to deliver the Welcome to Country, Rosemary Wanganeen. She is a proud Aboriginal Australian of Kalma, Wirangu, Kugatha and English heritage. Please give Rosemary Wanganeen a very warm welcome. Thank you, thanks.
Thank you so much for that introduction. So I also want to say thank you to the Australian Primary Healthcare Association for inviting me to perform this very special Welcome to Kaurna Country on your one-day conference, Building on the Best. It's always an honour and a privilege to perform them because it gives me an opportunity to connect to and acknowledge my Kaurna ancestry and ancestors on my dad's side. And on my mother's side, I acknowledge my Wirangu ancestry and ancestors from the west coast of South Australia. When performing Kaurna welcomes, I always bring an educational component for it to be interactive. For example, Kaurna group welcomes, I would ask you Namani. Which means, are you all well? And in response, you would say, Mani Ardlu, which means we're all good, or as we say in the Nunga community or the Aboriginal community, we're all deadly. Some of you may even know that term. So when I ask you, remember these images. So I'll say Namani. And so I'm going to put up these images, and I want you to keep these images in your mind. So when I ask you Namani, I'm not going to have the word up there. I want you to think about the images. So Namani, so instead of money, it's Mani. And so Uluru is a hard rock. And you can probably imagine the last one. So Mani Ardlu, so keep those images in your mind. And I'm open to suggestions. If anybody's got other images, I'm open to different ones. So this is the official welcome. Namani? Fantastic. So continuing with the educational component, Tandanya is the Kaurna word for place of the red kangaroo. And for those who may not be aware, Tandanya is the name of our National Aboriginal Cultural Institute, which is an art gallery full of Aboriginal and Torres Strait Islander art from around South Australia and Australia. And many more aren't aware that Kaurna country is far and wide. If you imagine a wheel with 9 spokes, and the city of Adelaide is the hub. These spokes, they approximately extend into the following places. Crystal Brook, which is about 2.5 hours north of Adelaide. Then back down in a southeasterly direction into Clare, which is about 1.5 hours from Adelaide. Still in a southerly direction into Gawler, and follow the foothills of the Mount Lofty Ranges, continuing in a southerly direction to the south coast to Cape Jervis on the Fleurieu Peninsula, which is about 1.5 hours from Adelaide. And to complete the circle, we'll turn around and head north up the Gulf of St. Vincent, pass by Adelaide, into Port Wakefield, into Port Broughton, and back into Crystal Brook. Furthermore, many aren't aware that the Adelaide Hills is the place of the Purumung people. My welcomes always acknowledged my gratitude for the sharing of modern Australia. However, I also acknowledge my deepest sadness for the human cost to us as Aboriginal people for this sharing, but realising and I hope it'll always be we, all have a right, a role and a responsibility to be part of the reconciliation process. In so doing, we can move forward as one nation to a place of equity, justice and in partnership together as contemporary Aboriginal and non-Aboriginal Australians for the health and well-being of our future generations under our Great Southern Cross. The makeup of One Nation of Australians has many cultural identities, and this is what One Nation of Australians really looks like. So when we walk upon Kaurna country, our Aboriginal and non-Aboriginal ancestors ask us to tread gently to minimise any further harm to not just Kaurna country, but to the whole continent and to Mother Earth. Thank you again to the Australian Primary Healthcare Association for this honour. I can't stay and join you for the day, but I know you'll have a fantastic day. So, Namani. Let's try that again. Namani. Fantastic. Have a great day, guys. See ya.
Ladies and gentlemen, please thank Rosemary once again as she's leaving. Thank you, Rosemary. Namani? Mani Adlu. I'm really happy to have learned that, and it's a really important message of our role, responsibility, and in reconciliations. And in reconciliation, and to tread gently. There's always so many great messages and a reminder of the importance of our First Nation people. And now I'd like to give you a warm welcome to you all for coming. This is like a record. It's fantastic, isn't it? So a warm welcome to you all for coming from all over Australia. This is our 11th National Conference, a conference for all of you exceptional nurses working in primary healthcare. A conference with the theme Building on the Best, because this conference is not only about acknowledging the essential work you do in our communities and recognising your skills and professionalism and kindness and the essential role you play in keeping us all healthy and helping us manage our illnesses. This conference is also about providing you with a unique opportunity to hear amazing experts. We've got an incredible program for you and speakers, and to attend incredibly useful workshops and to build on your skills and to build ideas about new models of care and to be inspired and challenged and stimulated. It's also a forum to build on your network, so to meet each other and share your ideas and work together to build a platform for you to have a louder voice at the table of healthcare policy and programs. This conference is for you, and it is up to you to wring the last drop of stimulation and fun and everything out of it. So, just go for it. And if you want to ask me anything, feel free, but not just at the moment. I've just got a bit of housework here. We've already jumped feet first into the conference. Yesterday with day one, we had practical workshops covering important topics like ear irrigation. Fantastic. And I mean that. My mother's ear was irrigated with kerosene. And she's nearly completely deaf now, and she's got macular disease, so she's completely blind. She said, if I was a horse, I'd be put down by now. And I said, no, you wouldn't, Mum. No. She goes, you want the wooden spoon? No, I said, no. Anyway, since I saw you last year, I've got a new eardrum too, because my someone didn't put Kero in my ear, but it might as well have been, and now I can hear you. So and I've got a hearing aid too, so you've got to get one early. So you already know that, but use it or lose it. So you've got to connect those. Yeah. Anyway, shut up. So we've also got practical workshops on nurse-led clinics, better questions for better health outcomes. We had the AGM. We had the fabulous meet and greet last night. Wasn't that fantastic? Those exhibitors are incredible. And am I still on? Yes, I am. Last year, I don't know if the person is in the room today, but last year I was told that one of the days my suit pants were clinging to my legs. And one kind lady came up just before I came on stage, and she said, if you don't want your legs to cling to you, and I think these are clinging to me now, she said you might like to moisturize your legs, so thank you to that. That's the sort of primary health care that we need. And I didn't have any moisturizer on me, so I rushed into the exhibition hall, and I found the bio-oil people. And I don't know whether they're here this time. I didn't see them last night, but I quickly rubbed bio-oil. It didn't actually work for my pants, but my apparently dry, crepey legs were really beautiful afterwards. So I'm hoping they're not sticking today. We have, last time was amazing because there's so many incredible exhibitions. I hope you had a chance to look. They really, just as me as a civilian, seeing all these new ways of approaching things like diabetes and palliative care. There's a palliative care box that, because I'm the patron of Palliative Care Nurses Australia, I was particularly interested in this care box that you can take home, and you can administer your own medications to your loved ones at home, and that's an incredible innovation. It seems an innovation to me. So, because we don't want our elderly people in hospitals. Hospitals aren't set up for elderly people. They're set up for diagnosing and curing, but they're not set up for people who are dying. So the more we can keep them, I told you last year, if you weren't here last year, I've got a 94-year-old mother and a 91-year-old dad. And they're going all right, except for major chronic underlying things. But apart from that, they're okay. Now, speaking of health, let's see. I think I told you, yes, in the interests of health and safety, the exits are, and the bathrooms are out there too. Please don't confuse the two. It is unhealthy to use the exit as a bathroom and unsafe to use the bathroom as an exit. If you want to know where an exit is, just ask a smoker. They would have sussed them out already. As a courtesy to each other and to our speakers, please put your mobile phones on silent and only answer them if it's lotto and they want to know where to send the check, if they do that anymore. Having said that, we have a Twitter handle and a Facebook thing and an Instagram thing, and we are encouraging a complete immersion in wonderful social media. Where would we be without social media? Probably talking to people at the same table, looking them in the eye. Anyway, but having said that, if you would like to share the excitement and thrills of today with people who unfortunately couldn't come or weren't invited, please feel free to join the conversation on Facebook, Twitter, and Instagram. The handle is hashtag, we got it up to here, hashtag APNA conference and at APNA nurses, APNA nurses, hashtag APNA conference and at APNA nurses. So we'll get tweeting and share all the wonderful things. This is a record-shattering event. Like I said, it is 120 speakers, 60 sessions, 700 delegates, and 55 exhibitors. A round of applause to the organisers. Unbelievable. We have incredible speakers from here and overseas, including, I don't know how they did it, but the organisers have managed to secure or snare or rope or chain or something that the cave diving anaesthetist hero, Richard Harris. Isn't that amazing? It's just... Apparently they did it before he got his, all these honours and things, and then they locked him in. They paid him immediately, and they just locked him in. And he's going to be here, which will be it'll be incredible to get that insight on something we all feel like we know about, but there's so many questions. We have great speakers, from leaders in their field to outstanding peers with learnings to share. We also have provided every opportunity for you to increase your leadership skills and to update your clinical skills. We also have a chance to celebrate this fine profession in style by having the rock star thing tomorrow night. Or tonight. Don't miss it by going tomorrow night. We dress up as rock stars, and then we just, let our hair down and scruff it all up and, paint on tattoos, whatever you want to do. It's going to be great. There's still tickets available at the registration desk if you want that. I'd like to really deeply and sincerely thank our wonderful sponsors, our treasured sponsors, without whom this conference would not be possible. Well, it would be possible, but there'd be a lot less to drink tonight at the Rockstar thing. Our platinum sponsor is Securus. Our gold round of applause. Woohoo for Securus. Our gold partners, GSK, Reframe Osteoporosis, Essentia Diabetes Care, Sanofi Pasteur, the Australian College of Mental Health Nurses. They're our gold partners. We thank you. And our silver partners are Pfizer, CDM Plus, and Rural Doctors Workforce Agency. Another round of applause. So a huge applause to all of our who's here? We've got 300 first-timers here today. Could you stand up, please? Thank you for coming. You've got a gold star on your lanyard already, a gold star just for coming. So thank you very much. Welcome. You'll just have such a great time. So thank you for coming. How many years? That's right. Have we got time for this now? Oh yeah, we've got a couple of minutes. So I thought I might ask you how many years you've been in primary health care. So who are the absolute newbies? Like, this is your first year in primary health care. Would you like to stand up? Yeah, it's good for you. So, welcome to the family. Welcome. That's interesting. So, and how many have been in primary health care for, say, up to 5 years? If I get you all to stand up and then we'll see. Everyone stand up. So this is the way we'll do it. Stand up and then we'll just, you know where I'm heading here. I want to see who's been in primary health care for the longest. Okay, if you've been in primary health care 5 years, sit down. If you've been in primary health care 10 years, sit down. 12 years? 15? I'm just doing this randomly. I've never done this before. Maths is not my strong point. 18 years? 20 years? 25 years? Oh, that's got rid of a few. Thanks. We'd be here all day. 25 years. Round of applause. I suppose we better go 27 years? 28? 29? 30? 31? 32? 33? 34? 35? 34's gone. 35? There's two of you here. 36? 37? 38? 39? 40, 40. How many? How many years? 42. Oh my God, there's someone else. 40? 42. You would have seen so many changes, so much happening. You must be really inspired by what is happening for nurses in primary care and the recognition you are slowly getting, and the amazing organisation like APNA, just being able to bring so many people together. 42 years, congratulations. That's just so impressive. Okay, let's get on with it. Last year I said how my family needed you so badly. I'm not going to go into all that, but I just want to say last year I told you about, the only time I'd ever had a nurse with me with a doctor, and that was, when I lost the garlic. Some of you may. Anyway, I don't think I'll tell this. All right, I'll tell the story again. Well, the only time I've ever been to a clinic where I've actually seen the nurse, apart from after I had children and they had cuts and things and we'd go into the nurses' station, was once when I was very young and I had thrush, and friends said, I'll put garlic and yogurt into your vagina and that'll cure it. So I put garlic and yogurt and then the next day I couldn't find the garlic, and it was quite big, and so I didn't know where it'd gone. I didn't even know whether it could go further. I didn't know anything because we were never taught anything about our gynae bits at all. I didn't know whether the cervix just went, oh, garlic, yum, I actually thought your uterus was always this big, cave thing. It was only, many years later that I found out we're all cryovac in there, We're like, our uterus and everything is like a big, peanuts. They're but I always thought it was open, So I went to the doctor and when I went into the doctor, I said, my problem is I put this garlic into my vagina and I can't find it anymore, and I was wondering if you wouldn't mind having a look. So that's when he brought the nurse in, because anyway. And then my dad, who I've been talking to my dad recently, my dad's got terrible breathlessness, and I went, Dad, because years ago, 2 years ago, his doctor said, Roy, you've got to go and get one of those balloon things, put up your artery, and we need to have a look at, I don't know, his heart maybe, yeah. So I think that's what, or unblock the artery. I don't even know really. So anyway, Dad was booked in, and I thought, oh, I'll just wait till he goes for this procedure and find out more about it. And I kept waiting, and I kept asking my dad, what, have you gone yet? No, it's not. Then finally I said, Dad, when are you going for this procedure? Oh, it's in a couple of months. And then I found out who his specialist was. So I rang up the specialist and I said, just wondering when Roy Kittson's appointment is for this procedure. And the secretary said, actually a friend of his rang up, Bert, and told us that Roy wouldn't be coming in because he was better. Dad hasn't got a friend called Bert. He just rang up and called himself Bert. But this is, if only when he'd left the GP that he'd had someone like you to talk to explain it, or we could have gone, can we just talk to someone about this and be reassured that it was, anyway. I'm so thrilled to be here with you all, and I've had the pleasure in the last year of being able to use primary care nurses a lot more. Now I understand, once I learnt about your role and what I could ask in our local clinic. And now, ladies and gentlemen, I'd like to introduce to you our host, the APNA President, Karen Booth. Karen has vast experience in all aspects of healthcare, clinical, administrative, and also training and mentoring. But her true passion is preventative health. Key to this is the development of systems to utilise skills of the whole general practice team to support health prevention activity and care. Karen is also a leading voice for primary care nurses, having held positions in many committees and advisory groups, including many at the Australian Government Department of Health level. She is a force to be reckoned with, a tireless advocate for primary health care nurses, to officially open the conference and to warmly and formally embrace you all. Please join me in welcoming to the stage the President of APNA, Karen Booth.
And as they put the step in, you'll note that I'm a short force to be reckoned with. Welcome, everyone. It was wonderful to have Auntie Rosemary Wanganeen here from the Kaurna people to welcome us today. And I thank her for her warm welcome and to hear our beautiful city of Adelaide. On behalf of APNA, I acknowledge and pay my respects to the traditional owners of the land, the Kaurna people, and pay our respects to their elders past and present, and I acknowledge and pay respects to any Aboriginal colleagues and friends that are meeting with us here today. So, good morning everyone. Jean is a very hard act to follow, so I'll do my best. This is our 10th APNA conference, and here we are all together celebrating and building on the best. I extend a warm welcome to our dignitaries and our special guests, and we are delighted to have attracted such an array of international and homegrown speakers who will contribute to the Building on the Best program over the next few days. APNA extends a big warm welcome to all of you here, and we especially extend a big welcome to our members. Looking out on the stage, from the stage, I have to say I'm so proud of the direction our organisation is heading. We are into our 19th year, and as I said, our 10th annual conference. And when I look back to our first big gig, our first conference in 2009, when we were looking down from the stage, there were 215 nurses at that first conference. And I can tell you today, the attendance at this conference is now 712, and that truly is building on the best. There are nurses here from every state and territory, from most remote regions to the inner city, which reflects we are truly a national organisation. And we have some amazing and interesting groups here today. We've got nurses that have travelled from faraway places to share our enthusiasm, educational experience, networking, and most importantly, our vision. I know Jane has just done the runaround of who's new and who's not, and 240 new nurses to our conference, or nearly 300, is amazing. But we also have representatives here from 57 PHNs. We have a large swathe of nurses that are sponsored by the Rural Doctors Network. Do you want to put your hands up, guys? Because I know there's quite a lot of you there. We've had nurses sponsored by Health Workforce Queensland for scholarships. We have groups from IPN and Helios here today, and we even have a couple of reps from the Australian Army. So whereabouts are you? There you are. We'll catch up with you later. We have nurses from Cape York and from Groote Island. So where are you guys? We'll make a special attempt to catch up with you. And we even have someone from New Zealand, so kia ora. We are very much looking forward to hearing your stories, your teachings, and sharing your knowledge and ideas about primary health care. And I know I say this every year, it's got to be a bit like a dad joke, but it will get very, very noisy later, and I shall walk around with the noisometer, and if you're under level, I'll give you all a poke to lift it up again. We have a great start to the conference and the pre-conference workshops on Thursday, including a very high engagement with our PHM project officers from all over the country. And again, I have to say, these were the biggest pre-conference workshops ever. They're fully subscribed, and we added another stream, and that was fully subscribed too. So I think pat yourselves all on the back, because it was really an amazing effort. We're delighted to have so many of you here, networking and celebrating primary health care. So the theme for this year's conference came as we reflected on the enormous growth and change in primary healthcare nursing, particularly over the last few years. We not only see nurses as key drivers and change agents, but that nurses help to expand the type of and delivery of primary healthcare services, and we see nurses as the building blocks of strong primary healthcare system and we know that nurses can make things happen. We've seen our membership continue to diversify, and this adds richness to the picture and to the voice that APNA puts forward on your behalf. We have a nurse practitioner elected to the board, and we also have a representative from Prisons Health, which I think again shows the enthusiasm that other nurses in the primary healthcare sector are bringing to our organisation. We've developed a number of partnerships with PHNs, and this enabled us to extend the number of clinics and transitioning nurse placements that we had originally planned under the Nursing in Primary Health program. 2019 has also been the year of the consultation. So anyone who's been writing policy papers for their workplaces or organisations will know it's a busy, busy time. And it seems like the current government has reviewed every aspect of healthcare, and I believe the opposition has stated they're committed to set up an Australian Healthcare Reform Commission. And the really good thing is both sides have asked APNA to contribute. As you're aware from the news updates, I've been the primary health care nurse rep on the General Practice Primary Care Committee as part of the Medicare review. I've also participated in the nurse practitioner and allied health reference groups. And we talk about APNA being the go-to organisation for all things in primary healthcare nursing. I can tell you that we had APNA members invited to be on all of the committees at the General Practice Primary Review. And there are a few people here today, Chris and Julianne and Jane Truscott, is here maybe somewhere as well, all did amazing jobs contributing to those committees. The consultation papers for those reference groups are now open for you to look at and to give comment on. APNA has done so for the MBS review, but will also put in responses for the other reference groups for that committee. And once they're done, they'll go up on our website. Now, there are other moves afoot. A quick update on some of the other exciting things that are happening in our space. So there are moves afoot to extend prescribing rights to registered nurses in a shared care model. And in the primary healthcare space, this has the potential to affordably improve access for patients to share the workload, especially for things like repeat prescriptions. The competencies for the proposed registration standard endorsement for scheduled medicines for registered nurses prescribing in partnership. Those competencies have now been written, and there is a big meeting next week in Melbourne to actually go through those competencies with peak body stakeholders, and yes, APNA definitely will be there. But for me, the most exciting part for the conference will be the launch of the Nurse 2022 Value, Visible and Respected strategy. We've surveyed our members and we know what they want. A change in perception of nurses' value among their peers and policymakers, and of course members of the public. They want people to know what they do and to be valued for that. Improving their profile so their contribution is not only seen but recognised and more highly visible. We want to support greater flexibility and better utilisation of the health workforce and supporting all health professionals to work to their full scope of practice. And what you'll hear over the next few days, valued, visible and respected. There'll be more to come on that later in our session here. You may also be aware that there's a review of undergraduate nursing education being conducted by Professor Stephen Schwartz. And we are seeing, as evidence today, the number of new graduate nurses choosing primary healthcare as a career option. Exposure to primary healthcare nursing in nursing curricula continues to slowly improve, and APNA is connecting with students and universities to promote primary healthcare as a viable and compelling career choice. APNA has already had high-level access to Professor Schwartz, so we've had given one-on-one feedback with Professor Schwartz. There are a number of members who have put their hands up to go to the rotating consultation workshops that will pop up in the major cities, and again reiterate the APNA message for where we think the system can be improved to educate undergraduates around primary healthcare nursing. You, the nurses in this room, are a strong and capable workforce. You'll take back knowledge and skills you've learned over these next few days to your local communities. I see the conference as not only a hub of innovation, but also building on the best for primary healthcare nurses in Australia. I think, as Jean said earlier, the presence of our sponsors, and they come back year after year, reflects the recognition of nurses as innovators, and I acknowledge and thank all our conference and pre-conference workshop partners. I'm proud to lead an organisation that's going from strength to strength as our profile continues to evolve. APNA is the peak body representing nurses in primary healthcare, and APNA continues to support primary healthcare nursing workforce with high quality professional development activities, advocacy, and actively promoting contemporary models of primary healthcare nursing. APNA will focus forward to help achieve our vision of best practice primary healthcare nursing. And to finish off, I'm going to borrow slash pinch a very special word from Lindsay Tai. Lindsay, are you in the room? So some of us saw her yesterday and some of us will see her today. Lindsay has this amazing made-up word that she's actually hoping to get into the Macquarie Dictionary. The word is potentialiser, and her definition of potentialiser is a release of amazingness in others. And we hope your time at the APNA conference will be a potentialiser for you, that you have an amazing time, an amazing couple of days, and we hope you enjoy. Thank you.
Thank you very much to Karen Booth. Another round of applause. It is amazing what APNA is achieving, and just a recognition that they are going from strength to strength, and the clout they have, the influence, a seat at the table of all these important gatherings is really important. And as Karen said, nurses make things happen, and that's what we want you to do, make things happen. And now we have a video message from the Honourable Greg Hunt MP, Commonwealth Minister for Health. In January 2017, Greg was appointed Minister for Health and Sport. He is guaranteeing Australians access to health services and affordable medicines with the establishment of the Medicare Guarantee Fund to secure the ongoing funding of Medicare and the Pharmaceutical Benefits Scheme. Greg has struck partnerships with the nation's general practitioners, specialists, pharmacists, and the medicine sector. This is historic, as it is the first time a government has achieved simultaneous partnerships with all sectors, and underscores the government's rock-solid commitment to Medicare and delivering the healthcare people need. Mental health is an issue that is particularly important to Greg. Mental health touches nearly every family in Australia, and he is making this a focus of his role as Health Minister to improve mental health services. So let's applaud the Minister in absentia. And please
welcome to the Australian Primary Healthcare Nurses Association Annual Conference for 2019. To Karen Booth and Richard Harris and Sarah Brown and so many of you who are here today, nurses from around Australia, people involved in primary care making such a profound difference. I want to start by thanking you. I am the son of a nurse and the husband of a nurse, and so I understand and appreciate and deeply respect what you do. What's exciting is that the traditional model of nursing is evolving, from hospital nurses to primary healthcare nurses to nurse practitioners, those in aged care institutions and in so many other community settings. So your work is beginning to expand the range of medical care and clinical care that's available to Australians, no matter where they are. And it's a change and an evolution that I don't just welcome, I want to support. And I believe in it deeply and passionately. In particular, in terms of primary healthcare nursing, we're investing $8 million in supporting the work of APNA. And that work for APNA is working on transitions, bringing more nurses in to primary healthcare. Secondly, the work of APNA is on building capacity. And thirdly, it's about chronic disease management. Those three things are so important and so fundamental. And each of you will choose where and how you specialise and how you focus. But this funding is enabled and designed to help you achieve what you want to achieve with your community. Above all else, it's about delivering better outcomes for patients and better career paths for nurses. Thirdly, there's the new workforce incentive program, and this is designed to put nurses right at the heart of primary care practice. It's about a flexible primary care practice arrangement with incentives to attract nurses, in particular to rural and remote locations, but to support their role in the primary care setting. So I'm interested in your ideas. I'm interested in hearing how we can improve our structures to help you improve your own careers and, above all else, the outcomes for patients. I want to thank you and acknowledge you, not just as Health Minister, but in particular as a son and as a husband.
Thank you to the Minister, the Honourable Greg Hunt MP. We like to control our ministers, so we insist on videos. And now we're thrilled to have in the flesh the shadow Tony Zappia MP, who is the Shadow Assistant Minister for Medicare and Member for Macon, South Australia. Tony has lived in the northeastern suburbs of Adelaide since early childhood, attending Peruka Primary School and Enfield High School. He began full-time work in 1969 with the ANZ Bank, and from 76 to 80, Tony was employed as a research officer to Senator Jim Kavanagh. Between 1981 and 2007, Tony part-owned and operated a local fitness centre. He was also an Australian powerlifting champion and an accredited fitness and weight training instructor. Tony served as an elected member with the City of Salisbury between 1977 and 2007 and served on different member boards, committees and community organisations. He has been the Mayor of Salisbury, and under his leadership the City of Salisbury became a world leader in environmental and water management. Please welcome the Shadow Assistant Minister for Medicare and the Member for Macon, South Australia, the Honourable Tony Zappia MP.
Jean, thank you very much for that warm welcome. Ladies and gentlemen, good morning, one and all. Can I also particularly acknowledge President Karen Booth, Vice President Mel Kamati, CEO Ken Griffin, my parliamentary state colleague Chris Picton, the Shadow Minister for Health, and I do also acknowledge Minister Greg Hunt in absentia for his presentation just a moment ago. But ladies and gentlemen, can I say it is indeed good to be with you and good to be back in Adelaide, the land of the Kaurna people. For your interest, I only just flew back in this morning. I was in Canberra last night and caught the red eye to come in. And I did so because I thought this conference was indeed important. And can I say it's great to have it here in the city of Adelaide. In saying that, I do begin by acknowledging the Kaurna people, the traditional custodians of this land, pay my respects to their elders past and present, and also acknowledge their ongoing spiritual relationship with this land. In saying that, I just came back from Canberra last night. You would probably all be aware that there was the opposition budget reply last night. And the great thing about that was that health, public health, became the centrepiece of Labor's budget reply with a $2.3 billion commitment to cancer treatment across Australia. Probably the biggest investment in Medicare since its inception. Having said that, I would just want to turn to your conference, and I note that this is indeed a well-attended conference, and just looking around the room and when I was watching the people standing up, it is not only terrific to see how many of you have been working in the health sector for so long, but it's certainly very much dominated by women. And can I say that is something that I personally think is terrific, because we quite often look at employment across this country and tend to suggest that we could do better in terms of getting women into the workforce. Certainly in the nursing space, women are doing more than their fair share. Primary healthcare is indeed the front line of our healthcare system. And in my view, nurses are on the front line of primary healthcare. You not only serve a critical role in the service you provide, but you are indeed highly valued. For 22 consecutive years, nurses have been rated as the most trusted profession. That is testimony to the importance of your work and how you do it. You are the person a patient feels most at ease with, whom they can talk to, and whom they trust. And can I say, when it comes to health, there is nothing more important than trusting the people that are caring for you. For most Australians, health care is indeed the number one priority. And while Australia has one of the world's best healthcare systems, our health system is very much under strain. It's too often disjointed and inefficient. It needs reform, and that should start with an increased focus on primary health care, so that health problems can be treated early and where we can increase our effort in preventative health care measures. In that, I see an even greater role for primary health care nurses. Labor understands that, and if we are fortunate enough to be elected, we will make changes in a considered way where all health sectors are brought together. And Karen mentioned this in her own address, but I'll refer to it. The first step will be in establishing a National Health Reform Commission. It will be an independent legislated body that will develop and oversee a long-term health reform agenda. It will be a body explicitly charged with reducing health inequality and improving the universality of our health system. And it will report not just to the Federal Health Minister, but to all governments through the COAG process. There is also, as most of you would well know, an MBS review currently underway, which will be not only of interest to all of you, but it's of interest to us. And Labor will await the completion of that review. The Australian Health Reform Commission, combined with the MBS review, as well as a thorough appraisal of the government's healthcare homes trial, will be very important in achieving primary healthcare reform that we are looking at. Wherever that reform lands, primary healthcare nurses play and will continue to play an increasingly important role in Australia's healthcare system. And I expect that APNA will continue to ensure that you are all well trained in preparation for that. And indeed, in respect to the training, can I say, as I was reading your report from last year, I was indeed impressed with the number of workshops, nurse clinics, and online education courses that are provided each year, and how many of you take them up. That is important, because if nurses are to play a more important role in the delivery of healthcare across our nation, you obviously need to be well prepared and well skilled up for it. But if you are, it also leads to the ability to give you more important roles or more roles to play within the system. So can I commend APNA for the work that is being done in the skilling up of the nurse workforce in this country. With those comments, can I wish you well for your conference? Certainly, I will be keeping in touch with you, and if we are fortunate to win the next election, then I look forward to working closely with APNA.